Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Good afternoon and welcome to the POMA Does podcast. My name is Tyler Burke and I'm the Senior Director of Government Affairs here at POMA. Today I'm joined by Dr. George Wolters, President-elect of POMA, and we're here to talk about what's happening in Harrisburg and how it impacts osteopathic physicians and their patients across the Commonwealth. Before we dive in and before I let Dr. Wolters say anything, I want to play a short clip from Governor Shapiro's recent budget address.
Consider this. In urban counties in Pennsylvania, there is one primary care doctor for every 222 residents. In rural counties, there is one primary care doctor for every 522 residents. That means rural Pennsylvanians who already have to travel further distances to get to their doctor also have less access. To ensure every Pennsylvanian, no matter their zip code, has access to high-quality healthcare professionals, we've got to take action to build a more competitive healthcare workforce. Across this whole budget, we take steps to find more doctors and nurses where we need them most. And we expand an existing and successful loan forgiveness initiative to incentivize more healthcare providers and behavioral health specialists to take jobs all across our Commonwealth. There are also common sense steps we can take to ease these shortages that don't come with a price tag, like giving full practice authority to highly educated, highly qualified nurse practitioners who work under a licensed physician for at least 3 years. This is smart, and it's already passed. The state Senate passed a bill last year on a bipartisan basis. Pass it again, send it to the House, get it to my desk, and let's get this done.
Now, Dr. Wolters, you just saw a clip from Governor Shapiro's budget address that occurred back in February. What is your reaction to these comments based as an osteopathic physician and a leader here within POMA?
They were certainly unexpected, and I did feel blindsided. I've practiced medicine in Pennsylvania for over 3 decades. I had assumed that Governor Shapiro would speak with us prior to making such a pronouncement, but he did not. Physicians spend literally their entire careers, med school, residency, continuing their education throughout practice, trying to provide high-quality care. It's a concern if they wish to turn care over to someone less well-trained. It is very frustrating. Let me be clear. Personally, I have respect for non-physician practitioners. I brought the first physician associates into emergency medicine practice in Delaware County back in the 1980s. They did an excellent job, especially since they were part of our emergency care team. It functioned to give high-quality medical care, and it decreased the significant delays within the emergency department. They were not practicing independently, though, and that type of care team seems to work very well. What the nurse practitioners and Governor Shapiro are advocating is totally unknown. We simply don't know what will happen.
Exactly. And from a policy standpoint, it is especially troubling because POMA has stayed at the negotiating table on CRNP independent practice, even after the CRNPs walked away from a negotiated deal back in 2020.
I recall, and that's an important point. Can you elaborate on that a bit?
Absolutely. So back in 2019, POMA and other physician organizations spent more than a year negotiating with CRNP representatives and legislative staff. This occurred over multiple months, a lot of hard-fought meetings. I was not in the position at that time, but my predecessor was, and I have heard multiple stories from this and how much this was a good faith negotiation from both sides up until the point that it came together. So the compromise that was reached was a 5-year pilot program that would have allowed independent practice in HPSA certified areas. Now, for those who aren't in the know on what a HPSA certified area is, it's a health professional shortage area, or what is deemed by the federal government as the areas of most need for healthcare providers. And so the idea here was to gather the data. Let's get the data that could help lawmakers make informed decisions and protect our patients. And so if the data did come back after those 5 years, we could then move forward in an informed way. But after this negotiation and compromise got out of the House, the nurse practitioners walked away. And since they have walked away, they haven't come to the table in a good faith way since. Most recently, POMA participated in a roundtable discussion between the nurse practitioners and the physician groups again this past September. And the physicians, we all sat around the table. We said that we are here to negotiate and try and get to a point that is good for both the patients, the nurse practitioners, and the physicians. And the response from the nurse practitioners was, we want all or nothing. And it was very disheartening because we were there to negotiate.
What do you think the governor's statement means in practical terms?
It means we're likely going to see a renewed legislative push for CRMP independent practice this budget season. So last year we saw this, and it was a lot more out of the blue because we didn't have Governor Shapiro telegraph it. And a issue such as scope of practice historically isn't one that is brought up during the budget season. Budget is for the financial health and well-being of the Commonwealth, and it is constitutionally mandated. And so for this issue to be brought up, it is kind of an interesting point of time for it to be examined, but we are preparing for it. And so in the next few months, it's going to be an absolutely crucial time for our members to be involved. So budget season really begins in February with the budget address, but it kicks up in April, May, and June when the legislature returns to Harrisburg. And so June 30th is the constitutional deadline, but that deadline has become more and more of a recommendation in recent history.
So how does POMA prepare for this?
So POMA's been doing a multiple prong attack, and we're prepared to protect our patients and our profession in the best way possible. We've already been up on the Hill meeting with legislative leaders, committee chairs, and key members in both chambers to stress the importance of maintaining physician-led care. We're sharing data, telling stories, and making the case that independent practice won't solve workforce shortages. For our members who are listening, we need your help. I'm going to be very blunt. Without you, our advocacy runs out of gas. And so if you can hear me and you're listening to this podcast, please keep an eye on your emails and communications coming from POMA as we move closer to June. We are going to be asking all POMA members to reach out to their legislators as state representatives, state senator, and the governor to explain to them why CRMP independent practice won't deliver the claims that nurse practitioners are saying. And I do just want to remind everyone, we're coming off the heels of a very historic election. And so we just need to remember that your voice matters. Hearing directly from physicians in their districts will change minds and will make this a battle instead of a foregone conclusion. And so we really need grassroots advocacy. And so please keep your eyes peeled to POMA's communications.
Couldn't agree more. It is time for us to stand together, not only as a profession, but for our patients.
Absolutely. And those are the ones who are going to be the most targeted in this because CRNPs, if given independent practice, will not likely go to the places of greatest need. They'll go to the urban and suburban areas where physicians are already in supply. And so we will see a no change to rural healthcare. And this is a promise to a lot of people in rural healthcare that won't come true, and it'll leave a lot of people in a lurch. I would also like to mention that on a practical basis, the CRMP proposal seems to be a political bandage for serious systemic issues that we have in Pennsylvania. Currently, Pennsylvania is suffering from historic low reimbursement and hospital closures and the looming threat of private equity. Dr. Wolters, how do you feel about these different issues as we move towards the June budget season?
Well, it was discouraging that it seemed every legislative cycle, they suggest a 5% cut, and then we agree on just a 2% cut rather than a raise. In practical terms, it's difficult to run a practice without being able to pay for high-quality physicians, without being able to pay for high-quality staff. It becomes even more difficult when there's a lack of support from our political leaders.
I think this is another area where we need to highlight that grassroots advocacy really does work. And if our members do reach out and educate their legislators about their concerns and, hey, we need to increase reimbursement, if it doesn't happen immediately, it's at least in their mind and something that when it comes up, they'll remember. And so there's a lot of issues that we need to start laying the groundwork for in Pennsylvania.
But I also suggest it was the first time I had done it, but when you talk to one of either the state senators or the state house members, they are extremely personable. I was really surprised. I had a very brief meeting scheduled to talk with a state senator and wound up going through about an hour and a half because we had a lot in common. We were from the same area. We knew the same kind of high school football teams, that sort of thing. But I think we forget a lot of the times that the politicians really are just people. I was impressed. I've done it a number of times and I've been really happy each time that I had a meeting with them.
Absolutely. And one of the things that I do want to highlight as somebody who meets with legislators every day, one of the things that we do see is the impact that constituents have on their policies. One example that I've had since working here at POMA is Dr. Valerie Roth out in the western side of Pennsylvania. She worked extensively with the Department of Health, the Department of Human Services, State Senate, and members there that represented her in regards to the closure of Sharon Regional Hospital. And so there's a lot of political power and capital that our members have, and we really need to start flexing it. And so this is a message to all POMA members to please participate in grassroots and let your voice be heard, because it will only work to improve your patients' lives and your lives. Good afternoon. Tyler from the future here. I just wanted to stop in and say that you heard us talk about private equity and the impact that it has on the Pennsylvania healthcare system. I wanted to let you know that in a future episode of POMA Does, we will be sitting down with Dr. Valerie Roth to discuss her experience as a physician dealing with the closure of Sharon Regional and their fight to reopen it. And unfortunately, this seems to be a trend that is continuing across the state and will likely happen more and more into the future. So please keep your ears peeled for that. I did also just want to circle back and say, if you are a POMA member and you are concerned about independent practice, please keep an eye to your email, as we will be updating you throughout April, May, and June. Thank you, and thank you for listening to POMA Does.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.